Good afternoon. My name is Ann Perez with BU Well, and I'm here with Dr. Jane Gervasio, who is a pharmacist and professor at Butler University. And today we are going to be speaking with Dr. Gervasio about some topics discussed in the BU Well article, the ketogenic diet, an answer for autism. Now, Dr. Gervasio, would you like to introduce yourself before we begin our discussion?
Certainly. So I am the department chair for pharmacy practice and a professor at Butler University. I've been at full-time at Butler since 2004 and enjoy the teaching role and glad to be here.
Good. That's amazing. And we're so happy you're here and we're thankful you're here to speak with us. And so with that, let's get started. So our first question is, can you tell us about any diets that you've heard of in the past that were shown to be successful in treating any chronic diseases or illnesses or just helping alleviate symptoms in general?
So we've looked at many diets over the past, and there's been hundreds, if not thousands.
Yeah.
And they have spanned from the cabbage diet to the paleo diet to hunter-gatherer diet, all sorts. And each have an interesting role, but if from a consistency standpoint, the one that has shown over time to be probably one of the healthier diets is the plant-based, including the Mediterranean diet.
Wow.
And so those we have seen have success over the years, and when you look, they're using fruits, colorful fruits and vegetables. They're using whole grains, the fats that have your omega-3s, your monosaturated and your polysaturated, not the heavy diets that we can see individuals consume that are high in saturated fats, trans fatty acids, processed foods. And so if you just look over the span of time, the diets that continually have been successful over the years include the heavy plant-based diets, the Mediterranean diet. So yes.
And what sort of illnesses do you think a doctor would recommend the Mediterranean diet for, or any sort of diet like that?
So many of your popular diets have been used. Those have been used successfully in diabetes, obesity. We try to, as long as we're not too far behind, anything that you can sustain for a period of time. And so many of these fad diets, that's where you lose them, right? Because you can't sustain that for a long period of time. You can't eat cabbage 3 times a day for the rest of your life.
No, I wouldn't like to. That would be horrible. But what have you heard about the ketogenic diet? Have you heard anything about this either professionally or in pop culture? It was very popular for a little bit there.
Yes. And history repeats itself. So the ketogenic diet is not new. Atkins, if you look back in the 70s, used that diet and made that diet famous back then. But we have been using that diet, believe it or not, close to 100 years.
Wow.
Only in a select population, and we were using it in children who were not getting results from seizure medications. And they implemented the ketogenic diet to treat. And they did have success in not necessarily eliminating, but at least decreasing the number of seizures that those children experienced. Subsequently, it was again in the 70s that Atkins kind of made a claim to fame, and it was a low-carb diet, anywhere between 20 grams to 50 grams that he would have these people consume. And there was actually a 2-week period with him where they took them down to small amounts of
ridiculously small.
Ridiculously.
Yes.
In fact, we had side effects. People were actually hospitalized because they would be having neurological effects from it.
Wow.
So you have to be careful. So we're seeing it come back again. So it did make a resurge again just recently under a different name, but it's the same concept, is that you're taking your diet down to 20 to 50 grams of carbohydrates, trying to get your body into ketosis. So basically you're trying to burn fat instead of the glucose or the carbohydrates that make the glucose that we use as energy in our bodies.
Got it. And so when we researched the ketogenic diet, kind of like what you were saying about seizures, they wanted to try this on autism patients and ASD patients because some of them were shown to have seizures as a symptom. So that was like the initial link. But what current methods of treatment are you aware of with ASD patients, or even medications that are on the market right now for autism?
So I'm not as familiar with the medications because I practice in the field from a nutrition standpoint. So I'll definitely let the experts talk to you about the
of course.
drugs.
Of course.
But I can talk to you about some of the diets. Yes, because we knew of the neurological results that we saw with the decrease in seizures, it does make one wonder, right? Can we use this in autism? Can we use this in Alzheimer's?
Right. That was another one, Alzheimer's.
Exactly. Can we use these in conditions where there is a brain function that we're really analyzing? And there's just not a lot of research. So we're really in those stages. Some of the diets, yes, this diet has been used, as has the gluten-free diet and the casein-free diet. And what we've seen and what the literature initially is showing is in a child or in an individual who is suffering from autism with the condition that they potentially have an intolerance to these foods, there is an improvement. The challenge is it is the caregiver who is usually trying to navigate this with the individual patient. And so it's hard because there's already, many of these individuals already have a select food diet that they want, and they're fussy or picky, and that's fair. Most children are. And so you have to be working with that, and now you're trying to inhibit elements from a diet. So if you're looking at casein, you're looking at dairy products. If you're looking at gluten, you're looking at wheat products. If you're looking at ketogenic diet, you're really decreasing their carbohydrates. And so for especially a child, that's very difficult. You're taking out a lot of elements that they actually like in their diets. And so if you're working with that, you have to be careful, because we don't want these children to become malnourished on top of it as we're trying to help them. So it's finding the right balance, being cognizant. If the child does have an intolerance, though, finding that intolerance to that food can actually help them. Because it does become, just like with us, anything you discover as you're eating that you can't tolerate, or causes you to be tired, or causes you to be irritable, taking that out of your diet is going to help you. The same is going to happen with an individual with autism. But trying to find that in the mix of everything else can be difficult. So you do need to be working in concert with your physicians, with your healthcare providers, so that you are understanding what is going on, and you're making sure that that individual is getting the right nutrients. So implementation of multivitamins may be necessary, minerals, just keeping your eye on that.
Got it. And we talked about how diets in general, and even the ketogenic diet, could be helpful for patients. Is there any chance that it could be harmful on the other side for patients to change their diet in such a way?
Yeah, so kind of what I spoke to, watching the nutrients, but there are patients out there, renal failure patients come to mind. You have to be very careful when you're altering their diet, because, again, they're not eliminating electrolytes like you and I would. They have different spectrums that they can go to, so giving them too much protein can be a problem because they can't eliminate it. So we're very concerned with this trying to put a patient in ketosis who also has renal failure can be extremely dangerous. And so you just have to be careful, and you have to understand your patient and know what you're recommending before
every patient's different.
Every patient's different. Exactly.
Got it. Okay, so last question. We just want to know, Dr. Gervasio, what does nutrition mean to you in general?
Food.
And being healthy. Yes,
and
we love
healthy.
Food. We love food.
Exactly. So nutrition is... it is your diet, and you have to respect that what goes in does fuel your body. And so good fuel is good for the body. You just can't get away from that. We try. So diets, these unique diets, I usually tell people, if it stimulates you, if you start losing weight and that motivates you then to move in a positive direction, It's not a bad thing, but look for diets that you can sustain for a lifetime, because what you eat, your nutrition, is your lifetime. That's what you're going to be on. And so forming good habits earlier is imperative, because you'll see that those individuals will continue those good habits. But it's never too late. And we see great successes in just a short period of time with a positive change for a heavy plant-based diet. Like I said, we're not going to get away from fruits and vegetables and our lean meats and, our whole grains. So that's not going away.
Good.
So if you can eat a good diet in that manner, and the treats are absolutely necessary, just life in moderation is best.
Perfect. Well, thank you so much for talking with us,
Thank
Dr.
you.
Gervasio. Thanks.